Hey, well, good afternoon, everybody. And good afternoon, citizens that are watching at home. My name is Matt Massarello. I'm the state's attorney for Wicomico County. And with me at the table are community leaders. We have Sheriff Mike Lewis. We have the county executive, Bob Culver. We have Lori Brewster, our county health officer, Mayor Jake Day, and Chief Barbara Duncan. And we're here today because we get a lot of questions when we're out on the street and out in the community about what our county and what we as leaders in the government are doing about the county's and the state's opioid and heroin crisis. Just to give you a little perspective, in the entire year of 2015, we had a little over 100 overdoses at PRMC. And just in the first 3 months of this year, we've exceeded that amount. And so we, as leaders in the community, Mike Lewis, Chief Duncan, their officers, people that are involved in law enforcement, we're on the front lines. And they respond to the overdoses, but we deal with, all of us deal with the aftermath. We deal with the moms, the dads, the human element to this crisis, and we feel the impact. It's having a tremendous impact on the citizens of our county. It's having a tremendous impact on our quality of life. Users and addicted individuals are committing crimes. They're drawing resources such as emergency resources. They're showing up at the ER. We have a death toll that's mounting. So we want to let the people at home know and the citizens of Wicomico County know everything that we're doing to combat and to address this public health crisis. So each one of us, I think, has a piece here because essentially Wicomico County's had a three-prong approach to responding to this epidemic. The first is the law enforcement piece, which we have a tremendous narcotics task force. We do high-level drug investigations that go and we get dealers that are dealing this poison at all levels. So your lower level dealers, your mid-level dealers, and the higher level dealers. And we'll have Sheriff Lewis talk about that component. Our office, once we get the cases from the city and once we get the cases from the sheriff's office, I think we have a proven track record of being vigorous in our prosecution of those individuals who are poisoning our community. And I believe Sheriff Lewis will tell you about the connectivity. We have individuals in addition to his deputies and the chief of police and her officers. We have the DEA here. We have the marshals here. We have great connectivity so that we can get these dealers in the state and in the rest of the states of our nation. Some of our investigations have led to the arrest and prosecution of individuals in Texas and California. So when we get questions from the citizenry about, they hear about the dealers here that we're getting and the dealers here that are being sentenced, and they want to know about the suppliers, well, we want the public to know that there is great connectivity between our law enforcement and what they're doing, not only here in the county, but the state of Maryland and the entire state. And we have one of the nation's experts on drug interdiction right at the table, right in our community, working hard to make sure that we're doing our best on that front. The other part about the plan is, of course, intervention. We have a lot of individuals in Wicomico County who are severely addicted. We can arrest them, we can prosecute them, we can put them in our detention centers, but as soon as they're out, they're right back in because they're severely physically addicted to opioids and heroin. There are a bunch of steps that we've taken as a county over the years, and we're not Johnny, we want the public to know, we're not Johnny come lately to the problem. We have been meeting and managing this problem for a number of years, and I want to go over, and I think all of us are going to speak to, the various steps that we've taken as we've progressed as a county through this crisis. So we have a lot in place for intervention. You have the drug court program. We've had 300 citizens since 2005 move through the drug court program, which is a prosecution and holding people accountable, but at the same time using common sense approaches to getting people off of drugs and managing their addictions. We also have a Made for Excellence program as part of the drug court program, which teaches them life skills. Because we're talking about rehabilitation, we're talking about bringing someone back to their former state, and some of these folks, their former state was not enough to get them on the right track. So we have to teach them life skills such as planning and business skills, financial skills. They have to get a job. They have to get some job training. We have a holistic approach. It's like probation on steroids, if you will. They come to court almost every week. And it takes an opioid addicted person or a heroin addicted person approximately 15 months to 2 years to get through that program. It's very vigorous and very onerous. So the public can rest assured that we're holding individuals accountable in that program, but we're employing a common sense approach to trying to treat that individual so we stop that revolving door. And everybody wins when that happens. The citizens win because they're not being burdened by a couple things. They're not being burdened by that person committing crimes in their community. They're not being burdened as taxpayers paying for the endless periods of incarceration over and over again. So we see that as a win. We also are, the third prong of our approach, of course, is prevention. And one of our prevention initiatives that is sponsored by the Sheriff's Office and the City Police and our members of WNTF, the Narcotics Task Force, is a scholarship program for teens in our county, which will end May the 1st. It's a film and art competition where we're having teens teach other teens about the dangers of prescription drugs and how they lead to the heroin abuse and use. So with that said, I would like to turn this over to some of my other colleagues, especially Lori Brewster here, who is going to tell you about another initiative that we have, which is the COAT program, and that is an outreach team. I will tell you from experience as a prosecutor, the model of how law enforcement does its job has evolved over the last several years. Collaboration and communication are key. We use this model in the Safe Streets program. All law enforcement agencies, they meet regularly, they talk, they communicate, they share data, and they share information. We believe this to be one of the factors that led to the decrease in violent crime in Wicomico County and the city of Salisbury. We have employed this same model to the heroin and opioid epidemic. We have assigned a person in our office who is who this was one of Mr. Culver's first initiative, was to create a person in the county called a heroin reduction strategist. His job was to know everything he could possibly know about our heroin problem and our opioid problem in the county. His job was to know how many people are in drug court, where in the office can we find people that would be eligible for drug court, how many people have overdosed, reported at PRMC, reported by the police, reported elsewhere by EMTs, how many people are in the methadone program, how is that going, how efficacious is that, what other programs do we have. We also send him to several different areas around our country. So he's visited TROSA in North Carolina, he's talked to people in North Carolina, New Jersey, Massachusetts, places where the opioid and heroin epidemic had hit hard and they already got their feet on the ground. They started working in strategies. We wanted to study those strategies and then employ those strategies, only the best for Wicomico County. And failure to plan, of course, is planning to fail. And the county executive agreed, and Sheriff Lewis agreed, and Chief Duncan agreed that we were going to get together and we were going to create a master plan for Wicomico County, basically a flight path for all of our stakeholders to follow that had aspirational goals, short-term wins, mid-range goals, long-term goals. The long-term goal, of course, is access on demand. Heroin users, the old model, what was happening here in the county and elsewhere, if the law enforcement encountered someone that came to them and wanted help, or a mom came to Sheriff Lewis's office and wanted to get help, because you're going to hear about Sheriff Lewis spending time with parents in their homes. The model was we could tell them to report to the health department during business hours. And then they would go to the health department and they would be screened, and they were told they would have to go for a physical about a week and a half later. We all know that heroin addicts in the midst and that deep, dark hole that they've put themselves in, they rarely made it through that process. So we did a couple things with the heroin reduction strategist advocacy. We shortened the amount of time between the time a person came to be screened and the time that they had their physical. So now the next day they get their physical. Now, if law enforcement contacts them, they got what was called almost like a fast pass, where they got to the front of the line instead of waiting, so that we could encourage them to go. Now we're taking it a step further with the COAT program, which is a community outreach team, which will respond once law enforcement identifies. So if law enforcement shows up and there's 3 individuals, one has overdosed, they've been taken to PRMC, but they often encounter others that are with that person that actually ask for help. I've received phone calls from his officers and chief's officers, and then I call Lori, and the two of us try to work out a solution, but there really is no solution. There's no support on nights and weekends when individuals are asking for help and they're in this vulnerable state that we can get them into treatment. And so what the COAT team will do, it will be a bridge between the time that they're asking for help, and will help that person follow them and guide them through the process, encouraging them, because these are peer counselors, individuals that have gone through the addiction process, that know things that I don't know as a state's attorney, Sheriff Lewis doesn't know, and Lori doesn't know. As people that have not had addictions, we have people that actually have lived this to help them along the way. Prior to this, again, I want to let the citizens know, we have been working on the opioid and heroin issues for years. Sheriff Lewis, Chief Duncan, Lori Brewster, the elected officials, we've been meeting regularly to monitor this process. One of the problems is, though, the data was so scattered and so fragmented, and there were so many barriers up. And it is what it is. No one's to blame. Sometimes the law was to blame. So PRMC saw overdoses come in, but maybe PRMC was not giving data real time to the health department or to law enforcement, and vice versa. Law enforcement was making contact with individuals. That data was staying in law enforcement hands. Health department was seeing individuals. That was in their hands. State's attorney's office, through drug court, we were dealing with individuals, and we come in contact with individuals. Now, as a result of the advocacy of the position that Mr. Culver created, all those entities get real-time data sharing about overdoses, so that law enforcement can track and see, well, are we having spikes? Are we having clusters of overdoses? And how can we respond as law enforcement? The health department can look at those clusters and see from the health department's perspective and make decisions about what they want to do and how they want to respond. And now with the COAT initiative, they actually have a mechanism to respond. So say we have fentanyl that's in the supply. Fentanyl is an additive. It is a drug that suppresses respiration. Just a couple micrograms of that drug will stop a person's heart. That's why we see occasionally spikes and overdoses and major fatalities. And you see this across the country when fentanyl's in the supply. Now we have a way through the COAT program to address clusters, to actually go out, because we can do press releases, but I just don't think heroin addicts are, maybe some of them are, but I just think some of them are in such a dark place, they may not be watching the news or reading the newspaper. But Lori's folks can now make direct contact with these individuals, and hopefully we can save some lives and we can change some lives. And in changing a life, it is much more expensive for this community to investigate, to prosecute, and to incarcerate, and to let the system be overburdened with the response by EMTs and the health officials. because you're paying for all of this. It is now time to be proactive. It is now time to use our creativity and to dream up solutions that didn't exist before to help this community through a grave crisis. And that's what this is all about. And I'm very proud to live and work in Wicomico County with people like Sheriff Lewis and people like Bob Culver and Jake Day and Chief Duncan and Lori Brewster. This is an incredible day for Wicomico. A lot of times the media plays up the differences between this executive and this mayor. Look at these guys, they're at the same table, because this is not politics, this is public safety and this is health, and it transcends everything. And these two have worked very hard on bringing this program and expediting this program for the citizens. So both of you gentlemen should be commended. Two other initiatives that we'd worked on historically, just so the county knows that we are not Johnny-come-latelys to the table. We were one of the first counties, just like we were one of the first, I think we are the first, to have a person that is basically a heroin opioid czar in the county, something that other counties are trying to replicate now. But we were one of the first to have a fatality review board. What we have been doing for years with Lori Brewster's initiative, the sheriff's office was participating, Chief Duncan's office was participating, Narcotics Task Force, all your health officials. Every time we had an overdose, we would take 2 or 3 at a time, and we would meet. This is for the last two years or so. We would meet and we would troubleshoot, and we would try to find out, did this person have contact with any health resources? Where along the lines, where did this person start their addiction? Where could we have intervened? Because the first responsibility of all of us at this table, and it's a reason why a lot of us responded to overdoses personally, to talk to addicts and their families, is to know thy problem. Until we understood the problem, until we really got to know the problem and what was going on, there's no way you can come up with solutions. So that's really what we did through the fatality review. We also had one of the first prescription drug task force. Salisbury City and the sheriff's office and other individuals, Dr. Cockey, the health department, Melissa Beatty Johnson from Riverside Pharmacy. So we had pharmacists involved. We met monthly to discuss this growing concern about overprescribing and the abuse of prescription drugs. And so that had been going on for years. We also had great coordination between when law enforcement had an activity. So if law enforcement or the government was working to shut down maybe a doctor that was overprescribing, well, whenever you have an action anywhere in any system, you're going to have a reaction somewhere else. So again, over time, we developed incredible coordination between all of those agencies. And one thing that taught us the success of how to collaborate and communicate, again, was the City Safe Street program. So you see all this interconnectivity between government working, government communicating. And I just think that is to be that's what we in Wicomico County should cheer about. There's too much focus on the negativity and the differences. And here, our community has been working tirelessly to get the connectivity. Lastly, again, I'd like to talk before we conclude about the state's attorneys and the Wicomico County Task Force intervention program or prevention program with the teens. Any teen or any parent of a teen that's home right now that's watching TV, and I hope our media partners will share the news, but we have a program right now. You can go to the county website. It's the first link on the county website. It's the Wicomico County Drug Abuse Prevention Art and Film Competition. And it is the first of its kind in the state of Maryland, and it's part of Governor Hogan's ideas in the task force, opioid task force that we were a participant of. It's an art and film competition that these kids can create a 30-second film or a piece of artwork and bring it to the state's attorney's office. The judging will happen at the third Friday in May. Again, more participation with the city. The scholarship's $1,000 scholarship in each category for first place, $500 for second place, $100 for third place, and the prize scholarship money was donated by the task force from seized narcotics funds. Those projects will be exhibited at Third Friday. We hope some of our media partners will play those 30-second snips of what the kids create from their eyes, how they view it in their schools. I think our eyes are going to be wide open when we see some of these projects. We hope that you'll consider putting some of that on your websites or airing it on your stations. And then those projects will go through when we have our festivals throughout the summer. They will travel and they will be exhibited so that we can create awareness. The cost of admission, or the admission cost to participate, is awareness. Parent and child must click on a link as part of, and they must certify as part of their entry fee. That's their entry fee, is awareness. They must watch a video created by the Massachusetts state government about a family that lost their daughter. She's like any other child that you've seen, how she started in high school abusing prescription drugs, and how that quickly grabbed her and did not let her go, and she rolled right into the heroin use, and which ultimately at the age of, I think, 22 caused her death. And that's something for parent and child to watch as the cost of admission or the entry fee for the competition. So I've spoken way too much, but I'd like to turn this over to Lori Brewster, who has the honor of introducing the COAT team and the COAT program, first of a kind pilot program in the state of Maryland.
Well, thank you, Matt, and I think that you've done a great job kind of overviewing everything that's occurring in Wicomico County. We are very, very proud to say that the county and the city have both agreed, I think, to assist the health department in managing this epidemic that we're facing. We met a few weeks ago, Matt and I did, about what could we do to begin to address this issue with the peer counselors. We know from health department experience that peer counselors have an inroad with a lot of the addicted population or the substance using population. So we have been in contact with the Salisbury Substance Abuse Community Center, Ms. Beth Olson, and looking at how can we partner in managing this epidemic. So we have put out a notice, done some PR to see if there are individuals that are part of that program that may be interested in helping us do some outreach with law enforcement, at the hospital with those that have overdosed, and follow these people as a bridge between the time that they wish to stop using until they can actually access treatment. We know that that's a difficult period for most, and most that we've seen have said they want to stop using drugs, and it may be a couple of days before they can actually access treatment. And as Matt said, they will go back and start using again, and that window of opportunity is missed. So we are really proud to say that we're a part of this project, and we're hoping to have it up and running mid-May, once we actually gain access to the individuals that are interested in participating. And this will be an arm of what we're already doing, a spoke to the wheel. We're doing a lot of other initiatives in the health department, some of which Matt described. Another initiative which is going on in the county is at the detention center. We're going to begin a Vivitrol program at the detention center for individuals that are incarcerated, so that we can get them on the Vivitrol program, which is an injectable medication that stops the cravings. So that we're going to provide the injection a month before they are released, and then they will be followed in the community for continued treatment. That is the most vulnerable time for those individuals, is upon release. And we see a lot of overdose deaths at that time within a couple of weeks of release from incarceration. One of the other things that we decided to do as a health department, we began providing walk-in appointments every day of the week to try to get these people quicker access to treatment. I will say that the volume has increased, and we can't accommodate all of those walk-ins. So we at the behest of law enforcement, said that we will give a fast pass to those individuals that have come in contact with law enforcement that have overdosed. So all they have to do is notify us, law enforcement notify us that these people are coming in, and they move to the head of the line. The other thing that we've done for many months is provided outreach and education on naloxone, which provides a overdose reversal for individuals. Most of our law enforcement have been trained and actually carry the naloxone. And we have been training community members for many, many months. We were one of the first counties to begin providing that training, and we're working to provide training to other organizations such as PRMC. So I don't know if there's anything else you want me to bring up.
Sounds like you covered most of what much of what the health department is doing. I'd like to allow my good colleague and partner, Sheriff Lewis, speak a little bit about the efforts, because again, this is a three-prong approach. You're hearing about the intervention, you're hearing about the prevention pieces, but of course, law enforcement, we are aggressively working to identify, arrest, and prosecute those individuals in Wicomico County that are dealing heroin and other drugs in our community and in the state of Maryland. They are working aggressively. I can tell you that from my perspective. We are going to hold offenders accountable. We're pretty heavy-handed with that because we have to be, because these are individuals that are dealing for profit. They're poisoning our community, and I just want to talk to Sheriff Lewis about some of the efforts on that end.
I think it's important that we all understand where heroin comes from. One of the frequent questions I get in the community is, where's this stuff coming from? Well, it's not cultivated or grown in the United States. Years ago, it was grown only in Southeast Asia, the poppy plants, and then it was grown in Afghanistan, Pakistan. It's now primarily being cultivated and down in South America, primarily Colombia, Peru, and Bolivia. I was recently asked to join the State Department on a trip down to South America, deep into the Andes Mountains, specifically to address the heroin epidemic here in the United States, primarily in the Mid-Atlantic region. And it was an eye-opening experience for me to go down to Bogota, Colombia, Cali, Colombia, and Medellin, and go down deep into the Andes Mountains along the Ecuadorian border, just to see the magnitude of what they're seeing down there, and to see these massive hectares. A hectare is approximately 2.4 acres of poppy being grown throughout South America. We in the United States, believe it or not, only make up 7% of the world's total population, but yet 68% of the world's total drugs are consumed here in the United States every year. We Americans have an insatiable appetite for drugs. It's not just heroin. It's cocaine. It's methamphetamine. It's marijuana. It's due primarily to our wealth. We are one of the wealthiest countries, if not the wealthiest country in the world. Therefore, we have a huge problem. The Mexican drug trafficking cartels are now trying to control the opium market worldwide, not just in the United States. Here in the United States, it's about a $360 billion a year industry, $360 billion with a B. And the Mexican cartels are fighting for control of the U.S. market, primarily because we're the largest consumers. They have recruited 9 Colombian cooks and chemists from Colombia, the Mexican cartels have, because they want to be a one-shop stop, not just for cocaine, not just for methamphetamine and marijuana, but for the heroin as well. There have been massive shipments of pure fentanyl intercepted in the United States, multi-kilos. Keep in mind, a kilogram is 2.2 pounds or 1,000 grams. There's a lot of fentanyl being intercepted all over the United States. And when we talk about the heroin epidemic we're seeing here in Maryland, and I know that's our concern, it should be our concern, but you need to know a couple things. I go all over the country and meet with other sheriffs and other chiefs. I was in Buffalo, New York last week. I was in Rochester, New York just last week. I was in Livingston County, which is in Mount Morris, New York last week, and met with the sheriff there. And every one of those 3 locations I just mentioned, the number one problem per the chief and the 2 sheriffs that I met with is the heroin crisis. That is our number one problem. Many of those overdoses that they're experiencing on a weekly basis are fatal because fentanyl is more prevalent in the New England region right now than it is in the Mid-Atlantic region. So much that the state of Massachusetts Lieutenant Governor has appointed a heroin czar for the state, and that would be a good friend of mine, Lieutenant Kevin O'Neill of the Massachusetts State Police. He is the heroin czar. But recently they intercepted 28 kilograms of pure heroin, unadulterated, uncut, pure heroin. Now, 1 kilogram or 2.2 pound brick of heroin here in the United States, uncut, unadulterated, will fetch between $600,000 and $900,000 per brick. That's unheard of. But it's pure now and has been more pure than ever before. Here in Maryland, I got a phone call the other day from the Delaware State Police asking me where they should look in certain vehicles. They had 2 vehicles that they had search warrants for. And they believe these vehicles, based on conversations, they believe these vehicles had false electronically controlled compartments built within these vehicles. Telephonically, I was able to guide them into these false compartments, and one vehicle just across the Maryland-Delaware line had 42,250 bags of heroin in it. 42,250 bags of heroin in it. Now, these false compartments aren't natural voids. They're not over the fender well. They're not under the seat. They're not just up in the dashboard. These are aftermarket installed electronically controlled compartments that are manufactured primarily by the Dominican drug trafficking organizations at a cost anywhere between $5,000 to $7,000 to have installed. But it certainly guarantees them concealment from most law enforcement, extensive searches on the roadside, or as a result of a search warrant. Even the best trained cops in the world cannot locate these hidden compartments, let alone breach them. That happens to be my level of expertise. They called me and we got them inside the compartment. These compartments are so elaborate. In order to breach them, you have to put your foot on the brake in many cases, hit the rear defrost button, activate the cruise control, push button number 2 on the electronic stereo, and then speak, and want to open up a voice recognition. These are very elaborately constructed. They're constructed of steel, pistons, trunk locks, very difficult to breach. But this is the level of sophistication we're seeing today in these drug trafficking organizations. Wicomico County is it's a beautiful county. It's a gorgeous county, but we are no different than any other county in the continental United States right now. You Google the heroin epidemic in Ohio, in Indiana, in Oklahoma, it's absolutely heartbreaking and heart-wrenching. I 100% commend the bright minds that are sitting up here today. These individuals have been a pleasure to absolutely work with. For Bob Culver, for Matt Mastrello, Lloyd Brewster, Jake Day, Barbara Duncan, and myself to say that there's a problem, listen, there's a problem. There's a major problem. We are addressing it in different ways that many people are not. As Matt said a while ago, the governor in his emergency task force spoke of several things he wanted us to do. We are way ahead of the ball. We are way ahead of the ball. I got a phone call last Friday from Kathy Slega. Kathy is a delegate out of Harford County. She's running for U.S. Senate. She said, I've heard about the great relationship Wicomico County has with Peninsula Regional Medical Center, your hospital down in Wicomico County. What are you guys doing that we can bring up to Harford County, because we're having a very difficult time with our hospital up here, getting them to share information. There's a perceived, and there has been, notion that we're not getting the information we need because of perceived HIPAA regulations that would prohibit the hospital from releasing certain things. But I will tell you this. We now have a greater relationship with PRMC than we've ever had, Roger. And as you well know, there are many, many cases that go undocumented. We only know and we report every overdose that we respond to, but I can tell you there are dozens and dozens of overdoses occurring every month that we are not notified of, that the hospital isn't notified of, that law enforcement's not responding to. Are we overworked in law enforcement? You bet we are, but we're no different than our brothers and sisters with EMS, fire department, our first responders, PRMC, the emergency room personnel there are overworked right now from overdoses. When you see the mothers and fathers come into my office with their children that are looking for help, and these addicts are sitting in my office looking at me for help, and they agree that they're going to help us in exchange for us helping them, it will break your heart. Beautiful lives are being lost every day due to addiction. And no one in this room, I repeat, no one in this room is immune from it, including myself. I have a 38-year-old niece sitting in our local detention center right now awaiting sentencing on heroin distribution charges. That's my 38-year-old niece. So nobody is immune from heroin addiction. Every one of us in this room has a neighbor, a friend, a loved one, an aunt, an uncle, a niece or nephew suffering from addiction. We'll never arrest ourselves at this problem. We realized that years ago, and we're trying to create alternative methods to treat those suffering from addiction and get to the young kids before they get addicted. It's a very, very challenging process, but we are committed. That's why we're here.
Thank you, Sheriff Lewis. I wanted to ask Chief Duncan. Chief Duncan, ladies and gentlemen, has been a valued partner with our office and with law enforcement and the health department, the county and the city. We've all been working together, of course, but her office has been involved in the drug court program along with Sheriff Lewis's deputies. They've also, Chief Duncan has been personally involved in responding to overdoses and set up a system where we would be alerted when there were overdoses, because we really needed to get information beyond just numbers and data and hospital information. We needed to get that layer of data that you get from personal interaction. So Chief was, set up this great alert system for overdoses where we could actually respond and get information from some of the families that were dealing with these issues so that we could make sound policy decisions. Also, her officers have responded to the burglaries and the break-ins in the cars and all the other nuisance crimes that are caused by opioid and heroin use. And so I just want to give you an opportunity to speak with the public, because I just think it's important to the public to hear your perspective and what Salisbury Police Department and the city of Salisbury is doing to work on this heroin epidemic.
As far as the city goes, it was back in late 2011, beginning of 2012, when we began to understand the gravity of the problem that we would be facing. We had a series of armed robberies of pharmacies here in the area, and through our partnerships with the state, with Sheriff Lewis, with Mr. Massarello's office, we were able to form a task force, and we were successful in quickly ending that series of robberies. The individuals behind it were addicted to heroin, and it had started based off of an addiction to opioids due to something as simple yet as tragic as a traffic accident, which began their addiction process. We worked also with the state, and we worked with our partners here, the businesses, the pharmacies here in the area. And we started to understand at that time just how large of a problem and just how deep of a problem this was. We had no idea what was going to happen across the nation and certainly here as well. But I could tell you that through analyzing this process, working with this problem, this tragedy that's really befalling all of us right now, every single resource in every community is being taxed because of this issue. We started working closer with our partners, started sharing more information with our partners, and as was relayed before by one of my colleagues, we are more than grateful for PRMC's cooperation and stepping forward to really start now, today, identifying just how vast this is. We're finally getting to a point where we can actually start collecting the very data that we need to succeed in this battle. And it truly is a battle that touches every family, including mine. We're not immune, none of us are. But certainly with the alert system that we have in place and all the extra work and the groundwork that's being laid right now, there's no doubt that we're going to make this process a lot smaller, and we're going to be very successful with it.
Thank you very much, Chief. I want to turn now to a person who is at this table who is very, very humble. This person is someone that his vehicle is probably one of the first vehicles that pulls up to their parking spot on East Main Street to start the workday, and that's Mr. Bob Culver. From my perspective, one of the first things that County Executive Culver did was he wanted a meeting with me, and he sent his staff to meet with me and Richard Bruckner and the rest of the prosecutors and law enforcement to really learn from us and understand what are the big issues that Wicomico County was facing. That was one of the first things he did, and it just impressed me tremendously. We met at his office regularly about the heroin and opioid crisis. He almost immediately put our plan into action. That was the Wicomico County opioid plan that called for the heroin reduction strategist. And that strategist has worked with the county executive's office, keeping them informed monthly of the overdoses that are reported, and every step, every action, because talk is cheap, every action that this county was doing was collected and then sent to the county executive to inform him about the progress. And the back and forth has been great, and that's how you see the evolution and the development of all these programs. Wicomico County our goal is to help people, of course, that's the first goal. But in doing that, in fighting to do that, Wicomico County has been the vanguard. It has been ahead and leader of the counties almost on every part of the game, every position of the ball. Wicomico County has been on the forefront, whether it's Prescription Drug Task Force, Fatality Review, the COAT program, reaching out to the teens. We need to be up front because we have a big problem. If Wicomico County goes, there goes the Eastern Shore, is what I would say. And so all these individuals at the table have been working. But I want to turn this over to Mr. Culver. County Executive Culver, could you just give the citizens your perspective and a little bit about what your office has been doing to respond to the opioid crisis and working with law enforcement, the health department, and the state's attorney's office?
Well, thank you very much, Matt. I guess probably the one thing you can say is this is not the proudest moment we have to sit here and face a problem, but it's a problem that we had to take on and face head on. So when I did come in the office, I did contact Matt and go from there. And basically the other things have been a no-brainer. Whatever he said that we needed to do, we've done. And to take exception with Mike, what he said, that we're like no other county in the country, but we are, because I have a team here that is probably the leading team in the state of Maryland as to our recognition of the problem, our collaborative effort to try to take care of these problems. So I want to thank you all for what you do, and I think the mayor and I will agree that whatever we can do to help you to face our problems, and that's how we correct them, by facing them. And you certainly brought us to light to where we've all kind of hidden it in the past, and it's not going to happen anymore. So thank you all for everything you do, and I'm proud to be a part of Wicomico County on this.
Thank you very much. Thank you very much, County Executive Culver. Another person that has indulged meetings with our office and with Lori Brewster and law enforcement, a person with tremendous energy, is our Mayor, Jake Day. Jake, would you give a couple moments to address the public as to the city's cooperation and assistance with both the COAT program and also your police agency and their response and your city response to the epidemic?
Sure. Mr. State's Attorney, thank you. And I appreciate the opportunity to be here working together. Matt, you said at the outset of this conversation that we're often known for the friction between city and county, and I think we all recognize that historically that's been true. But I think, and my experience has been that time and time again, that's no longer true. And we are working together, and this is just one example of that. The citizens of Salisbury are citizens of Wicomico County, and the citizens of Wicomico County shop and work in the city of Salisbury. We're in this together. I want to take a moment just to say that thanks to the information that Mr. Bruckner puts together and shares with the county executive and I, we didn't need convincing. I didn't need convincing. I think that information has been tremendously helpful in understanding that the problem exists. And know thyself and know thy problems, you said, Matt. That's something that's been fundamental for us. We've seen it firsthand in our communities, President Heath. We've seen it firsthand in our neighborhoods, Councilman Bowden. We've seen it firsthand in our loved ones, Council Vice President Mitchell. I know we're seeing it every day, and people out there are seeing it every single day. And so we've got to do something about it. So I want to commend the Salisbury City Council for being willing to budget funds to pass a budget amendment in support of the efforts that the county has led. I want to commend the county for that. And we have also added some funds in to a program that will attract, we hope, a high-level sort of national speaker to come talk to our kids in this community, which I think is a compliment to the great program that you discussed earlier, Matt, the Art and film competition, which I think is fantastic. Salisbury has also been working on standing up Salisbury's treatment and addiction reduction team in partnership with our friends and the fine organization at the Salisbury Substance Abuse Community Center. Beth, we appreciate the great work you're doing too. So look, we're in. We've got to fix this problem. We've got to address it. And we've got to start locally. I think we've all seen on the news some of the federal efforts and state efforts that are designed to assist us. But we've got to be creative and flexible right here. And the people at this table I know are doing just that. So thank you, Matt.
Thank you very much. I'd be remiss if I didn't bring up our county council as well. So we have city council members in attendance here, Laura Mitchell, Mr. Boda, Mr. Heath. All of these individuals have had meetings with me regularly to keep informed, and I really appreciate your assistance and your belief in the programs. I would also be remiss if I didn't mention our county council, who last night voted unanimously to fund the COAT program. So again, you're seeing politics shelved, you're seeing public safety, again, that value placed over politics, and I just think that's great for our community. I would also be remiss if I didn't mention our great partner in the Warden Calamarakis. What's great about the Wicomico County plan for getting through this crisis and the Wicomico County government is that there are no silos, okay? We all communicate, we all work together. Warden Calamarakis has been a very big player. Mrs. Brewster mentioned the Vivitrol program. Warden Calamarakis has also been a huge partner, a big part of the drug court program. Also, we are working to start up the RSAT program. What is RSAT? That is residential drug treatment in our local detention center. It is a national, I'm going to call it a best practice. I mean, we've studied some of the wins around, Richard studied some of the wins around residential drug treatment. So separating some nonviolent offenders in a segregated annex and giving them in a clinical setting treatment is the way to go. It's a way to stop the revolving door. It saves the citizens tremendous money. Well, Warden Calamarakis is working to get RSAT back online. We used to have it. When I was a defense attorney, I actually had a client that was in that program that's actually working right downtown Salisbury now, productive, reunited with their children. I mean, it was an incredible program, but because of funding cuts a long time ago, several years ago, it went away. And what happened? Our prison population, of course, it balloons. And who pays for that? The citizens. So we're working on, we almost got it online, but we had some funding setbacks. Lori is definitely on board to cooperate and provide the therapist, the therapeutic element. But we're working on with the with the state government and County Executive Culver's good contacts in Annapolis with trying to come up with the funding to restart our RSAT program, which again should help in stopping the revolving door and helping some citizens stop the cycle of committing petty thefts at Walmart and breaking into your cars and your homes and to get them on the right path. I'd also be remiss if, again, I want to point out PRMC is here. We have representatives from PRMC here, a great partner. We're getting tremendous data and information from them now. Also, we have Mr. Colburn from the Salisbury Area Chamber of Commerce, who has always been there for us, for law enforcement and for the community, volunteering the membership of his community. However they can help, they want to be there. He is also on the board at the SAC Center, which Richard Bruckner, again, the guy in our county that's supposed to know everything about the problem, he's on the board as well. They are having 1,000 new people knock on the door at the SAC Center every week in Wicomico County. 1,000 new individuals asking for treatment from the SAC Center every week in Wicomico County. So I thank you for your participation. Also, we have Greater Salisbury is here as well. So again, we have tremendous, and if you're here and I didn't announce your name, there's so much going on. There's so many players at the table. Please forgive me. Please forgive the slate. But your cooperation and contribution is very, very appreciated. So I want to end with, before we open it up to questions, with something that I know about Sheriff Lewis. And Sheriff Lewis is truly a community sheriff. We know him to be a tough sheriff. I mean, him and his folks, they're out there and they're going to hold people accountable that are dealing drugs and selling drugs. But I see a side of Sheriff Lewis. I mean, when I call him at 10 o'clock at night or 11 o'clock at night, he's in his office. I know what this guy does that nobody ever hears about. And I'm going to tell a tale about Sheriff Lewis. Could you please tell the public about some of the, or one of the interactions you maybe have had with a parent where they've called the sheriff's office and you've actually made a house visit to speak with mom or dad about what's going on and what they're seeing at home with their son or daughter?
Well, I frequently go to homes at night and meet with young kids suffering from drug addiction. Mom and dad does not want to bring them to the office. These kids are intimidated to come to our office. In many cases, the moms and dads know me personally and ask me if I will come to their home. And most recently, I went to a house to meet with a young lady over off of Snow Hill Road. She finally had a child 11 days before I walked into the home, and she wanted to get her life turned around. And she began to share all the information with me, who was dealing large amounts of heroin in Wicomico County, different crimes that had been committed by her boyfriend, crimes that had been committed by her boyfriend's associates. Because you need to recognize that 87% of all crime we handle here in Wicomico County, 87% is directly linked to drug addiction. 87%. So when I met with her, I was very optimistic that she was going to get her life on the right track. She had already gone and signed up for rehab, and I'm sorry to say that lasted 4 days, and she's gone back again to the criminal side after spending 2.5 hours with me at her mother's dining room table spilling her guts. She was ready to get back on the right track. So these are the things that we deal with regularity. And most recently, I was notified by one of the parents who brought her daughter in to meet with me, a beautiful 17-year-old little girl, that her daughter overdosed and died down in North Carolina last Tuesday. And I still have that girl's text messages on my phone where she had been texting me with regularity, and I was encouraging her to keep doing the right thing. And she didn't die here in this county, but she did die last Tuesday down in North Carolina. So this happens all the time, and Matt can tell you how many times we go to overdoses, and I don't go to all of them because I know a lot of people are intimidated by my presence and they don't want me there. I know that. But I feel a certain connectivity to these addicts in this county. This is our county. This is our home. This is our house. And it's very sad. This is, as Bob said, even though it's affecting everyone in the country right now, this is pretty unique. Wicomico County is a beautiful place. I was born and raised here, and I see a lot of my friends from school and families whose children are suffering from addiction, who have ultimately died from addiction. So it affects us all. No one's immune from it.
I want to conclude before we open it up for comment that this is not there's no mission accomplished banner behind us. We're not here patting ourselves on the back for solving a problem. In fact, a lot of these solutions, this is tough work. This is tough work, and there are no guarantees that we're going to save everyone. Of course not. But Wicomico County is going to try, and they're going to do the very best that they can, and that's what we believe the citizens expect of each and every one of us. So with that said, I'm going to open it up to questions, and if there's anybody here on this panel that feels that there wasn't something covered that they'd like covered, I'd open it up to them as well. So any questions at all from the members of the press or the public?
Mr. State's Attorney, can you tell us how Wicomico compares to other counties as far as the drug problem? Are we the worst in the state? One of the worst in the state as far as the statistics?
I think I'm going to defer to Lori about the statistics. She can tell you exactly where we fit in. So.
As far as overdoses stand, we don't fall within the top, but I can tell you that we're not proud of where we're at. We have seen a steady trend on the increase since 2012. Last year, we had 20 overdose deaths. We're on track this year to exceed that. And as Mr. Massarella said, we had 100 individuals that graced PRMC's doorstep in 2015 with an overdose issue. And in the last 3 months, January, February, and March, there have been 103.
Those weren't deaths.
Those are not deaths, but those are overdose cases, which we're trying to prevent.
The prevention is the key, because although, you know, I'm a person that I get crime stats and I get overdose statistics, but I can tell you just from working, from my perspective, the problem is getting worse because of the burden on the system. The police are responding more. We're getting more calls. Also, I don't have confidence in the data because, as I told you before, the data has been so fragmented and siloed and stored in so many different places that I think now, at least Wicomico County is the first. I want to say, you heard about the problems that are happening in other counties about information sharing. We're the first county where everyone's dumping the information in one place, and we're actually getting a crystal clear picture. And it all depends on our resources. So when our officers are constantly calling and responding to overdoses, the thefts that are related to the addicted stealing and breaking the cars and houses and things like that. And then our chief of police was going to a bathroom when she was on a lunch break and found somebody in a bathroom that had overdosed. So again, everybody has these stories, and every family and citizen has these stories. I have lost a family member within the last 18 months. Extended family member, and I have lost a high school friend of mine from Stephen Decatur High School. I saw him take some of his last breaths at PRMC. So again, it affects every single person in this county and in this country. Everybody's affected.
Is there any particular age group being affected more than any other age group?
I'll let Lori give you the statistics on that. It was wild when we first started. I want to say generally, I'm just giving you generally anecdotal. We were seeing white, affluent in the 20s, and then we saw it bounce all over the place. And now you're seeing different members of all the different communities because again we have a diverse community. We're seeing a lot of people get involved, 40s, 50s, male, female. In fact, we had a lot of females one month, but I'll let you talk about the demographics.
We're seeing it, as Matt said, all over the spectrum. A number of individuals that are very young. Just recently, we reviewed an overdose death of an individual that was in their 60s. So it's all across the age spectrum. Of the ones that are being reported at the hospital, it's the same thing as well, all across the spectrum, from very young to the elderly. And what we're seeing is individuals unable to get prescription pain medications filled because there has been a crackdown, significant crackdown over the past few years. And we're seeing a lot of older people resort to heroin to manage their pain.
And several years ago, we did go to a meeting with Dr. Fowler. Again, this is just more, events is more that we've been on this for several years. But about 2 years ago, we went to a meeting with the U.S. Attorney and Dr. Fowler, one of the chief medical examiners for the state. And his trending was in the white, more affluent in the 20s. And so that's what we were seeing. And then all of a sudden, it just started bouncing all over where we saw every race, every age. And we're getting a lot of information from these addicts, because when we had that alert system, we went out to talk to them. So they talk to law enforcement, they talk to the medical professionals. Again, they're very nervous about giving information because they think they're going to be arrested and prosecuted. But so we wanted to get real information from them, and what we were learning was that most of them that I spoke with started as middle school students or high school students, stealing pills from their parents, their uncles, or using pills, prescription pills at parties, crushing them and snorting them. And then once the pills became harder to obtain, either through the crackdown by the script writing, or just, mom and dad didn't have the dislocated shoulder or broken arm or something like that, they then went to the local heroin dealer, okay, in Salisbury. And we also saw, on the law enforcement side, I think Mike Lewis would agree with me, in 2011, we saw a shift where we were finding a lot of cocaine, kilos of cocaine, and then all of a sudden we started to see this big shift to then buns or bundles of heroin and we saw a lot of gang members. So people that were, identified with the blood sets, the gang problem that Salisbury had, we started to see them start getting, figuring out this is a lucrative endeavor, and we started to find, heroin bundles and guns on them. So again, this is why the whole approach, the intervention, the prevention, and the intervention. We are not going to solve this problem with just simply law enforcement. We are not going to solve this problem with me. We're not just going to solve the problem even if we just said, hey, we're just going to handle it as a health care. It's not. It has to be a multi-prong approach to this problem. And that's what Wicomico is doing. They're bringing the full force of all of our areas of expertise to satisfy or to address this epidemic. Anyone else? Okay. Any members of the panel for any words before we conclude? Okay. I want to thank everyone who's in attendance today, all of the citizens and elected officials that came. I want to thank the press for your interest in covering this very important matter for our citizenry who really do want to know what their government's doing. And the government or the citizens that are watching today, please be on the lookout for all the other initiatives that are down the road, especially again, we're lobbying hard for money for RSAT. We really need residential drug treatment for our detention center. So again, use your leverage with your electeds to research it, and if it's in your heart, if you think it's the right thing for the county, make sure that you're calling your electeds to let them know how you feel. So with that being said, thank you, Sheriff Lewis, thank you, County Executive Culver, thank you, Lori Brewster, thank you, Jake Day, thank you, Chief Duncan, and thank you, citizens, for all that you do for the citizens in the county. We love this county, we love this community. God bless you at the table, and God bless the citizens of Wicomico County. Thank you.